Hello, hi. Welcome everyone to OB Healthy's. And this is the Doctor's Lounge. And we're a group of black physicians that are here just to educate. Educate about health. There are two major reasons that we are so happy that you've joined today and that what we're going to put down. Number one is to try to improve the health of people of African descent. Number two is to encourage black males to go into medicine because we're finding that the numbers are down and we need those brothers here to help our people going forward as far as medicine is concerned. This webinar is every second Saturday at 1 o'clock. And we're so happy that you've joined, but please, it takes a village, so let others know about it. Okay? 1 o'clock, come on to OB Healthy and click that doctor's tab and join us because we're here to answer your medical questions. If you want to check, and please do check our prior webinars because we got so many topics that are pertinent to African Americans. Please just go on to our website. Hit the doctor's tab, you'll come onto that page and there's a camera there. You'll see a camera. Just hit that camera and all our past webinars will come up. Or on the page, just hit our YouTube logo and all prior webinars will come up as well. All right. And once you come on to that YouTube, please subscribe so we can continue to bring this to you. Okay. I'd like to thank OB Healthy for allowing us to bring this to you because without their support, we couldn't do this. Alrighty. The most important thing that I can say today is please do not change any aspect of your medical care until you consult your physician because truly only your doctor can best treat you from a medical standpoint. All right. Our topic today is dentistry. We have a brother here that is outstanding as far as dentistry is concerned, and we're going to hit all types of topics. There's no question too small or too large. We're going to hit that topic, all right? So I'm asking you, don't be shy in typing in your medical question because sometimes I've talked to people and they're like, well, I didn't know if I should type in and I didn't know, well, my typing's not that good and I don't care. Put it down. We want to answer your medical questions. That's why we're here. That's why we do this every second Saturday. All right. Dr. Patrick Anderson in here, and understand that the other doctors will be shining on. I was in the hospital making rounds this morning, running around like crazy, and I saw quite a few of them that said, I'll be there, I'll be there, I'll be there. And, they're just trying to finish up and get here to do what we do and support our community. Dr. Patrick, yes, can you introduce yourself?
Yes, it's always an honor, second Saturday of every month. I look forward to it. I'm Patrick Anderson. I'm a gynecologic oncologist with the Barnabas Health Medical Group, primarily practices out of Newark at Newark Beth Israel Medical Center.
All right, thank you very much, Patrick. And me, I'm Dr. Omar Bey. Of course, probably the one that has the gift of gab here every second Saturday. I'm a retired pulmonary critical care physician, and now I'm director of nutritional support for the intensive care unit at Newark Beth Israel Medical Center. So I am so proud to be able to and humbled to be able to do this webinar every second Saturday. We have Dr. Haniel Rosemont with us. And Dr. Rosemont, I'm going to ask you just introduce yourself, but step back just for a minute and tell us how you got where you are, why you went into dentistry, and what are the satisfactions that you're getting out of your specialty? Because we all came through that. We all pledged those white jackets, and it's truly a pledge. But once we get there, it's worth it. So tell us about yourself, brother.
All right, thank you. First of all, thank you for inviting me. I think this is a very important group, and I'm glad to be here. I was born in Brooklyn, New York. I had the pleasure of having a few healthcare providers in my family. So one of the things they did, which I didn't realize how much of an impact it had on my life, all my early healthcare providers were people of color. And I was born in the 60s, that's all I'll say. So that was a pretty amazing thing to occur at that time. But it had a tremendous impact on me. because of the fact that I saw healthcare providers that looked like me, I felt very comfortable in a healthcare environment. Now, I also like to work with my hands and take things apart. So I developed a close relationship with my dentist, who was a Howard grad, which is where I wound up attending dental school at Howard University in Washington, D.C. So as a young middle schooler, he took an interest in me. I used to go to his office and he would show me different things and techniques and just basically mentored me along the way until I actually went to dental school. And so I really am blessed because I didn't realize how blessed I was to have all these healthcare providers of color until I got to dental school and I talked to some of my classmates about how we wound up where we were and where we are. So that had a tremendous impact on me. I didn't even realize I literally called my mother and said, and she said that was by design. So I owe it all to her and God. I think it's critically important to always give back. I love this forum where young people have an opportunity to see such prominent healthcare professionals that look like them and to let them know that they too can complete this journey. So let's talk a little bit about dentistry. I think dentistry sometimes gets a bad name. It is a healthcare service that we have to utilize more, particularly in the African American community. In the African American community, it's viewed upon as something that is emergent. I want to really educate that it should be more preventive. Just like you see your OB, your primary care, your pediatrician, you should see your dentist at least twice a year. Believe it or not, a lot of medical conditions show oral manifestations first. And if we catch it, we can also refer you to the appropriate healthcare provider. So I want people to start to not look at dentistry in a fearful way or in an emergent way, but a part of your overall healthcare. See all your healthcare providers at least twice a year. And in our community, we have such maladies as diabetes, hypertension. These are common maladies in our community that have oral manifestations. So it's important that you see your dentist regularly because we can help your sugar levels by getting regular cleanings and monitoring your quote unquote periodontal health or your gum health, because diabetes predisposes you to gum disease, or in our community, what we call pyorrhea. So also very, very important to come in and get regular treatment. I'll just be brief right there and we'll go to question and answers. I could go on and on and on.
You know what? The thing of it is, and I appreciate you going through your history because it's important for the young brothers out there to understand. When you say pyorrhea, that's a big word. What do we mean by pyorrhea? I know that certain times we get infections in the gums and infections in your teeth and stuff like that. But what do we mean by pyorrhea? Because it's important and it's something that maybe people don't realize they have if somebody around them don't tell. You understand what I'm saying?
Understood. So pyorrhea is more layman's terms when we as dental professionals call it periodontal disease. Periodontal disease has various stages. The first stage of periodontal disease is when your gums start to become inflamed. It's called gingivitis. Now we can go in and out of gingivitis. If you get gingivitis starts because the plaque on our teeth has bacteria in it. Our body's response to the bacteria is inflammation. The initial inflammation in the gums is gingivitis. Now, if you don't get regular cleanings, this can progress on to what we call periodontitis, where that plaque becomes calcified, hard, and becomes very tenacious into connecting to our teeth, leading to what we call inflamed gums and continuing on to what we call bone loss. That bone loss, think of the bone as the anchors of the teeth. As your bone starts to recede, your teeth can actually become loose and move. And if you don't treat it, it can get to the point where you can lose your teeth, all your teeth. And I think in our history, it was mistakenly thought that as we aged, we would lose our teeth. That was really inaccurate information. The most important thing is to get regular cleanings to remove this plaque and calculus so that you don't get the gum disease.
Mm-hmm.
Now, when you have certain health conditions, such as diabetes, this can happen at a more rapid rate and you're more susceptible to periodontal disease. That's another reason why it's quite important to get a dental exam, particularly if you're diabetic. Just as you should get regular eye exams, foot exams, you should also get an oral exam when you're a diabetic in particular.
All righty. Dr. Court, you've come in. Please introduce yourself.
Is Dr. James Court. I practice in East Orange, New Jersey, and I'm a fellow Howardite. Graduated in 1980. And I have something on Dr. Bay. He's not from Howard University. His wife is.
Just to catch you up on that, we were making rounds this morning, and he let me know that I am not one of the Howard grads. That's okay, Doc. I still love you. I still love you.
That's all right, Omar. You know, you're not alone. First of all, I'm not from Howard, so you're not alone. And two, we're from the same place.
I hear you, man.
So you got company. So it's 2 against 2. All right?
It's 2 against 2 right now.
All righty, Patrick, you have your hand up, please. Let us hear your question, brother.
Well, it wasn't even a question, more of a statement. You know, I think dentistry lost probably a good provider, because one day a patient asked me, "Well, why did you become a gynecologist?" I didn't have a good answer. I told her there were too many dentists. Because it seemed like we're the two most physicians that people hate to go to, right?
That's true.
Right.
That's true.
That is true. That is true.
But you know, on a more serious note, you know, to what Dr. Roseman was saying, in terms of when we see and evaluate a patient, you know, we can't be too tunnel vision and just so focused on what our specialties are, you know, because we know that, you know, good oral care in my world, you know, leads to good nutrition. And oftentimes, you know, one of the things that go with cancer care is loss of appetite. And if you compound that with poor oral health, then folks don't eat and their nutrition goes south. And, you know, they often, believe it or not, don't respond well to treatment. So, you know, that highlights, you know, the importance in my world of good oral health.
Mm-hmm. Mm-hmm. Excellent. Excellent. Dr. Court, your hand's up.
My question to the good doctor was to explain what is a wisdom tooth and what are the other different types of teeth that we have.
All right. Normally, anatomically, we have 32 teeth. Our wisdom teeth are considered our third molars, which are the most distal part, of the furthest part of our mouth towards the back. Interestingly enough, as we've progressed anthropologically, our mandibles have gotten a little bit smaller. There's research now saying it may be related to the fact that now we don't do as much suckling. Mothers don't nurse as much. They don't understand why, but as a result, the third molars do not have enough room to come into the mandible. This entrapment now, sometimes patients have no symptoms, sometimes they have a tremendous amount of symptoms and have to have them removed. You know, the lack of space has led to an inability to clean the area properly, more cavities, more infections. So now you hear it's fairly common amongst young people, typically around the age of 19 to 22, when the third molar's eruption time is due, that they may have some trouble and have to get the removed.
Now, what you're saying, Haniel, is that there's only so much space in our mouth for our
Correct.
teeth.
For our teeth.
And there may be a point coming in our lives that a tooth may need to come in and there's no space for it.
Correct.
All right.
The 19 and 21 is the eruption pattern.
So what you mean by eruption pattern is that it comes out on the side, or is it?
No, well, ideally it should come in straight
right
behind your second molars, which are your most posterior teeth at that point in time.
Right.
If there's not enough room, or if they come in at a different angle, they can be angles in various ways, and then you can have some challenges in terms of
So
comfort.
you have to have surgery to get that removed or what?
You may, depending on where it's located and what tissues and bony structures it's approximating. Sometimes it's approximating the mandibular nerve,
Hmm.
and it's a surgical risk. So then it becomes a clinical decision whether it's addressed or not.
Hmm.
The best thing to do, though, is get regular exams, and at some point in time, a patient should get what we call a panoramic X-ray, which is an X-ray that goes around the mandible, goes from ramus to ramus to truly evaluate the position of where their wisdom teeth are.
Right,
So
right.
it again comes back to regular exams.
Dr. Court, you're back again?
Yes, I do.
Yes, sir.
What, doctor, what's the current way that you treat extraction of wisdom teeth? Do you pull or do you crush them or what?
No, so depending on the location, remember there's some surgical hazards such as the mandibular nerve and the other teeth. Depending on where it's located, sometimes they're extracted. They now have adapted in oral surgery a procedure called coronectomy, where they may section off just the coronal portion, the crown portion of the tooth because of the proximity to some surgical hazards, not to put the patient at risk. But a lot of times, if they're creating pain and infection, they have to be clinically addressed in one way or another.
All right then. So it's a pull mostly. Most of the time, it's pulled out.
Pull, we don't use the word pull a lot.
But
Pull has a connotation
It
of
has that kind of connotation that
right,
no one wants to
connotation
know.
like a cartoon and no, we surgically remove it. Just like Dr. Anderson over here surgically addresses his tumors and everything. We surgically remove it. And
I got you, brother.
there are various techniques,
you're
hopefully
right.
atraumatic.
That tends to intimidate patients. You got to pull that thing
Well,
out.
pull my
Right.
tooth.
That word, they see that's why we try to get away from that connotation.
I got you. I got you.
Right, right.
Because I tell you, when I go to the dentist, boy, I'm thinking about that. I'm like, oh
I
boy,
I,
they're gonna be a pair of pliers up there.
forceps, forceps,
Not pliers. Okay.
not five, forceps.
All right. Patrick, please.
But on
Oh, go ahead.
all jokes aside, it really is a very important thing that I think patients should understand. We're here to help. Some of the things that have been in our community about the dental experience, technology has made a lot of things more atraumatic, more comfortable.
Mm-hmm.
So I don't want patients to hold on to those old fears and anxieties and not get regular examination.
Right.
Because, like anything else, when you let things progress further, then the treatment can be a little bit more challenging. So, early detection in anything is one of the best prevention.
Gotcha, brother. Gotcha.
Right.
Patrick.
Yeah, so oftentimes when we have these discussion, we have the discussion from an adult perspective,
Mm-hmm.
and I think oral health begin with the children, and from a public health perspective, one of the dilemma that we face now, albeit political, is how do we address prevention or nutritional dentistry per se, and one of the things that was fascinating to me is the concept of having iodized salt and how that impacts how incidents of goiter because people get the iodine they need, and from a chemistry perspective, iodine and fluorine is probably in the same location on the periodic table, and the impact of fluoride on dental health, and where do you stand with respect to fluoride, toothpaste, fluorine, and mouthwash, those kind of things. Can you talk a little bit about that? Because
Yeah,
I
yeah,
think that's influential in children, right?
thank you. Not only children, adults. I
Mm-hmm.
have a lot of my adults on fluoride supplementation. The politics right now is it's unfortunate that politics got into healthcare. Fluoride is one of the most prescribed supplements that I have in my practice. Fluoride has been very well researched as a positive influence on oral health care. There's basically one study that has been that wasn't a refereed study that occurred in Europe, where there was an area that had 5 times the amount of fluoride that we normally have in our American Florida, and they had 1 or 2 incidences where they thought it may create some pathology. That is the study that keeps getting quoted when they make fluoride a bad actor. It has been shown year after year, study after study in the United States in refereed studies that fluoride definitely helps prevent tooth decay, helps remineralize the teeth, and the communities that had fluoridated water have definitely had a reduced incidence of caries. Even Alaska, a few years ago, removed water fluoride from their water system, and they saw their caries rate shoot up so much that they put it back in. Now, politically right now, a lot of places don't have fluoride, including Jersey. There's a lot of counties that don't have fluoride. So we, the practitioners I work with, and particularly the pediatric dentists, we apply topical fluoride on patients' visits, as well as recommend regular fluoride toothpaste at home. And it's a very important part of our youth health care as well as adults. With my adults, to add to that, the patients that are taking, say, antihypertensive medications, it tends to make their mouth dry. Saliva is a lubricant, and the lubricating aspect of saliva helps protect the teeth. So when you have dry mouth, you are more susceptible to decay. That's why I have my adults use fluoride supplementation, because some of their medications may make their mouth dry. So it's not just the children.
I have a question. At what point, or when very young children, do you need to examine their teeth? Number one, to put the protectant on their teeth. Number two, and try to prevent those early cavities. And is it important to prevent the early cavities in the those first teeth that are going to fall out anyway before you get your real teeth?
Good, great question. There's a lot of misinformation on that. Pediatric dentists actually like to see children as soon as teeth start coming in. And for several reasons. They want to teach the mothers how to properly clean and take care of their teeth. They want to also be able to do diet and nutritional counseling, and they will do a little bit of fluoride supplementation, even very young. There's a challenge called milk bottle caries. Mothers have a bad habit of letting the baby sleep with the bottle in their mouth. That leads to a tremendous amount of decay and disease, and a lot of patients pediatric patients will have to get treated sometimes with extractions because of the amount of decay. Whenever you have a child and they fall asleep, take that bottle out of their mouth immediately. If they feel that they need to have a bottle go to sleep, just water, nothing else, just water. Because that's one of the challenges in our community, babies sleeping with bottles and getting what we call milk bottle caries. So first thing, to answer your question, as soon as teeth start coming in, they should be seen by a dentist that has pediatric training, preferably.
So,
Go ahead,
I'm
Patrick.
sorry, Omar. I try to keep it basics, because I feel that your teeth is like the rest. It's part of your skeletal structure, and if protected, it should last your lifetime, right? And obviously, as in some women, as you get older and hormonal influences, environment changes, the integrity and structure of the bone changes. And I have a few questions regarding that, where dental health is concerned. But even more, basic, and going back to starting when we were children, can you enlighten us as to the basic technique as to good cleaning? How do you properly clean your teeth?
All right, good question. So once the baby starts to have teeth, the first thing I tell people to do is get a clean. They actually have these things called finger cots, but you can actually take a clean face cloth even before, and just no toothpaste at that point when they're extremely young, and just literally brush their teeth and acclimate the child to you going in their mouth and cleaning, rubbing their gums as well as their teeth initially. And you can progress up to when the teeth are a little bit more developed, a small toothbrush, no toothpaste initially yet, and just get to brushing their teeth. When they get a little older, pea-sized amount of rice-sized amount of paste and brushing, and acclimate the child to having their teeth brushed. And actually, when they're growing and developing like that, brush the gums as well. And then as you progress up to where they actually have teeth. But once those teeth come in, they should actually be seen by a dental professional so that they can be taught properly how to clean the teeth, see how their diet and nutrition is being handled, and if they need any coaching along the way in those veins. Yeah. And also going back to the milk bottle, that can also occur with breastfeeding. Sometimes people think, oh, I'm breastfeeding the baby, that's natural. The babies can still get caries from breast milk.
Interesting.
So that's something that a lot of people aren't aware of. So they think, oh, I'm breastfeeding, it's natural, it's okay. No, they can still get caries from breast milk.
Right. You know, the thing of it is I have a grandson, and when sometimes he doesn't want to brush his teeth. Like, no, in that no stage, So what I find is that if I brush my teeth with him, then he'll brush his teeth as well, because it just all of a sudden he was like, well, you don't have to brush your teeth. Pop is going to brush his teeth right now. He's like, oh, no, I'm going to brush mine too. So just to get do you have clever ways that you can suggest that people can help their kids be motivated to brush their teeth?
What you just said is a very good tool, but the key is, as I said, if you start them early enough, it's something that they've become acclimated to and they don't really resist. So, when they're very, very small, if you start to they'll fight you a little bit, but when they start to see that this is part of their hygiene routine, they start to acquiesce. It's harder to jump in later if it hasn't been done in a while.
Right.
But I like the duplication model is a great model where look at dad. Now, when children start to exercise a little bit of independence, we said, okay, let them do it themselves for a minute. And then you say, okay, let me go behind you and just check and see how you did. So when they start to exert their independence, you can let them do a little something, but then just come behind them and make sure it's followed up properly.
Right.
Yeah, but by the same token, in terms of when you brush your teeth, what's recommended? When I scrub for the OR, they'd say for your first scrub of the day, you literally have to scrub, your hands 5 minutes, before you use any of the fancy alcohol-based cleansers. When you brush your teeth, how much time do you spend brushing your teeth? What are the various maneuvers that improves and enable you to properly clean your teeth?
All right. Nowadays we have the good fortune of a lot of mechanical devices that are really, really nice. The average time 2 to 3 minutes. Now, the old manual toothbrush, we had a technique we called the modified Bass technique, where you actually angled the toothbrush bristles towards your gums, and it's a circular motion, and you sweep away from your gums. And you actually literally do that all the way around, circular motion, sweep away on the tongue side and the cheek side of the tooth, and then you would brush the flat surfaces of their teeth. Nowadays, they have I love rotary toothbrushes. I like rotary more than sonic. And some of the rotary toothbrushes have timers on them. So when you turn it on, they'll run for about 3 minutes. And obviously, you should be moving along your teeth, along the gum line, making sure you get the cheek side and the tongue side on the inside, top and bottom, about 3 minutes. Flossing, I like to floss first and then brush.
I see.
And I'm really big right now on water irrigators or oral irrigators. And I tell people that's analogous to using a power wash. So after you brush and loosen debris and remove it, come behind it with that power washer. You'll be surprised at the amount of debris that comes out. Patients have their gums love that. We see patients that have very little inflammation in their gums, and a lot of times they've been using these type of devices in their home care regimen.
Mm-hmm.
Now, Dr. Court can appreciate this. When we were growing up as kids, and this was Dr. Court was way before my time, so he was exposed to this, more so than Omar and I. We were taught healthy ways to eat, healthy snacks, right? And some parts of the world we have some natural things that are beneficial, right? Dr. Court, you remember the chew stick, right? That vine that you chew and it suds up like soap, and you chew it all day, and your mouth just feels as fresh as ever. And we were taught that carrot is good for the eyes, but it's also good for the teeth because it's a natural toothbrush. The other one that I think is fantastic is sugar cane, right, Dr. Court?
Yes, that's right.
You chew that sugar cane. So
Okay.
can you talk a little bit about
Yeah,
some of the things we can put in the lunch boxes of the children that will help,
I
oral
like
health?
those things culturally too. I'm
Yeah.
aware of them.
Oh yeah, you're from Brooklyn.
Right, Brooklyn. The roots from we'll go into that later. But
Okay.
with the chew sticks, and if you really think about the sugarcane and chew sticks, when you start to chew them, what do they start to look like? A
A
brush.
brush. Yes, yes,
A
yes.
brush.
Yeah.
So they actually, as you chew them, you're actually brushing the
Right,
teeth.
right, right.
And the good things in some of those, they did have some natural elements that it wasn't fluoride. Like the sugar. Oh, I'm gonna go talk about sugar in a minute. But so they basically were natural forms of brushes.
Right,
And that's what helped keep the teeth clean.
right.
And they were more healthy nutrients in it. So sometimes it's our diet that also predisposes us to decay, but those are healthy fruit and vegetables. So that's why our teeth were healthier. It
Right,
was just naturally. But those were actually, in a sense, brushes.
right.
Or became brushes the more you chewed on them and
The more
played
you
with them.
chewed on them. Yeah,
Yeah.
coconut, sugar cane, those kind of
Coconut,
things. Yes.
sugar cane, you got
Yeah,
it.
yeah.
I got it. We have a couple questions that are come up, and I'm going to again ask the audience out there that if you have a question, please type it in. Don't be afraid to type your question in. None too small, none too large. We're here to answer those questions. First one: what dental work can't you have done while receiving and this is Prolia, Prolia shot for low bone density?
I'm glad that was something I wanted to talk about. There's
Mm-hmm.
certain medications now, we call bisphosphonates, or that are a challenge for dentists
Mm-hmm.
because if the patient is in need of an extraction, it can affect the healing of the bone and get a situation that we call osteonecrosis of the jaw. So it's highly recommended that people's endocrinologists, hematologists, before putting their patients on these medications, make sure they get a dental exam. So if there's any questionable teeth that need to be addressed and extracted in particular, that should actually be done before they put them on those medications. When they're on those medications now, we may require that they get certain blood tests to check the level of those medications in their bone, because we may have to put them on what we call a drug holiday, where they can't take those medications for 2 months or whatever to allow it time to leave their body so that they can get those dental extractions. So thank you for that question, whoever wrote it. It's one of the things that we're facing because these are new medications that are helping patients with their bone density and things like that can create a challenge for us as dentists. And even from an OB standpoint, going back to that, we recommend the OBs, once they identify the patients as being pregnant, to send them over for a dental exam to see if there's anything that we can catch early and nip in the bud, so it's not midterm or late term that we have some issues coming about, and it's a little bit more difficult on the OB side and the fetus, and for us as dental practitioners. So I keep going back to the same thing about regular examinations and cross-referring with your other health professionals to get a dental evaluation.
Mm-hmm. Now let's. I know with um, maternal death and stuff like that. Once you bring up OB, we got to go into it a little bit little bit more. When you say that there's an issue with OB, can you explain that with the fetus? Is there infection going to the fetus, or what's happening there
Well,
that we should worry about
so
for our
as
pregnant females?
As we mentioned earlier, about periodontal disease and the bacteria associated with periodontal disease.
Hmm.
That bacteria associated with periodontal disease has a correlation with preterm low birth weight babies. There's also some cardiac challenges that may develop or exacerbate cardiac challenges, kidney. I want people, and one of the analogies I tell my patients are you could try to be as healthy as you can be, eat organic, exercise, this and that. But if you don't have a healthy oral environment,
Hmm.
that's the last thing the food that you ingested touched. So if it's bacteria laden because you have periodontal disease, that bacteria is now being ingested. So if you have cardiac issues or whatever, or sometimes it's just the bacteria itself creates these situations.
Hmm.
That's another reason why, but it's been proven that it contributes to preterm low birth weight babies.
Hmm.
Well, I think, well, we when we practice medicine, and Dr. Court is so good about this. We can't be tunnel vision, right? And guys like Court, Dr. Court is like the point guard, right? He is looking to see where is most effective to distribute the ball so he can attack that rim. Where's the easiest path to that rim, right? Um, you know, Pregnancy, if you talk about that, is a relatively immunocompromised state, right? Because here you have a mother who's housing a protein load and an antigenic load that's foreign to her. So, in order not to reject this, as would have happened in someone who had an organ transplant, the immune system, adjusts itself to compensate for that, you know, foreign protein mass. So now, if you think of an infected tooth as an infected prosthesis, right? You think about how difficult it is to treat someone, Omar, who has an infected artificial joint
Hmm.
or have an infected artificial heart valve,
Hmm.
or even of osteomyelitis,
Hmm.
right? If you think of it in terms of that, that's a harder focus of infection to treat. So now couple that with a relatively immunocompromised state, some of these patients can have, subacute bacteremia, subacute, you know, um, infected tissue, and I assume that's how that would, influence the birth weight of a baby, how that would influence preterm labor. You know, I mean, I see it in some of these cancer patients who comes in neutropenic, low white cell count, at risk for infection, and all of a sudden they're bacteremic, right? And you're looking for the common source. You check the urine, there's nothing in the urine, but there's bacteria in the blood. What's the
Hmm.
source? Oftentimes it's from oral cavity.
Hmm. Hmm.
Yep.
Yeah, I know with cardiac surgery, one of the things that they do in lungs, cardiac surgery as well as cardiac transplant and lung transplant, the first thing they want to do is like, we got to send them to the dentist. Make sure their
Correct.
dental health is good before they go into surgery. It's very important as far as heart valves and,
Right. And it's
you.
for that same reason, right?
Hmm.
So now you do a transplant, right?
Hmm.
You put them on some immunosuppressant to
Right.
prevent rejection, and now
Right.
they're susceptible to an infection,
Hmm.
right?
True, 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 true.
Very true. Very
It all
true.
ties in. It all
Yeah.
ties in. We have some more questions. Let's get a couple more questions. Um, I may have missed this, but is it recommended that wisdom teeth be removed? As they state, but as she stated, why do we have them? Why are they created anyway if they need to be removed? Is it recommended just to remove them?
No, they shouldn't be removed. If they're asymptomatic and not causing any pain, infection, pressing on any vital structures, they shouldn't just be arbitrarily removed. There should be a clinical reason why they're removed.
Okay, excellent, excellent. Um, Let me see. Okay, this is another one. What condition of tooth decay is determined that would recommend a root canal and is there an alternative to this procedure?
Um, well, let's go into the anatomy of teeth. Teeth
Okay.
have three primary structures. The enamel, which you see, which is one of the hardest substances known to us. After the enamel, there's a layer called the dentin layer. And then third layer is the nerve or the pulp of the tooth. Now, cavities progress through the enamel into the dentin layer. The enamel, why we like fluoride is because fluoride remineralizes the enamel. But once the decay penetrates the enamel, it progresses through the dentin layer a lot faster. And if it hasn't been caught, it will continue onto the nerve of the tooth. When it hits the nerve of the tooth, that's the blood supply and nerve supply of the tooth. The patients can be symptomatic with extreme amount of pain or have no pain at all. But at that point, when the nerve in the tooth necroses, it becomes a source of infection. So it may not be painful, but you may be developing infection. And as we just discussed over and over again, we have these subacute affections that can flare up and spread. So at that point, that infection has to be addressed. One of the treatments for that infection is what we call a root canal, which is cleaning out that infected tissue inside the nerve canal and sealing it. That tooth then needs to be restored at either with the crown or some sort of restoration to prevent reinfection. A lot of times what happens is patients may get that initial procedure to relieve the pain, but if they don't get that restorative structure placed to seal where that initial decay started, you can get reinfected and the tooth can have a problem. That's one way to treat. Sometimes it just, when we might have to extract the tooth. But
Now,
we can't let that subacute infection just sit there. It's a ticking time bomb.
right, right, right. What about as far as the nerve is concerned? Do you alter the nerve at all for the pain, or is it more just cleaning the infection away?
Well, at that point, the nerve supply of that tooth has been compromised. That's why the patients are symptomatic. Once that bacteria hits that nerve supply of that tooth and the blood supply, you have a situation that you have to clinically address. And that's
Right,
when we clean that out inside the tooth. That
right,
doesn't affect the nerve supply of the mandible and the other teeth.
right.
But of that particular tooth, that has to be addressed and treated properly.
Okay, all right. Interesting, interesting. Um, okay, I think this one may have something to do with one of the other questions. It says, what medical plans do you take, if any? I'm not sure who this is and how it relates. Um,
I think they're just asking about insurance coverage for
oh,
dental.
medical plans. All
Yeah,
right,
yeah.
I got you. I
Hmm.
got you. Yeah,
So
can you cover medical plans? Because a lot of times, even though you have medical insurance, guess what?
you may not
It
have
may
dental
not cover
insurance.
very much. So
Yeah.
tell me some.
Well, that's not my area of expertise, but I'll just say this: dental plans, just like medical plans, vary from employer to employer and year to year from a contractual thing. Today, in this political climate, there's a lot of challenges going on right now with insurance plans in general for healthcare.
Mm-hmm.
So that's the best I can answer that question at this time. It's such a fluid situation going on right now with healthcare. But I will say that because you have a medical plan at work, you may not have a dental plan. And it's just something that all I can say is somewhere or another, try to get regular dental exams just like you get your regular physicals.
Right, right. I
Yeah, so
have.
Dr. Roseman, like you, I use my hands a lot, right? And of course, you become interested in material integrity, right? And for me, the equivalent of that is the mandible and the bones of the face, right?
Right.
So here one of the big conundrum for me is, so I put patients on bisphosphonate, and someone in the chat mentioned Prolia to try and restore the bony matrix to make it more solid. Um, I'm not clearly understanding what is the issue with dentistry. Is it an issue with if you create a disruption, it won't heal, or is it that the bone, the integrity of the bone of the jaw is affected?
That's it. If you create a disruption such as an extraction, the healing can be compromised to the point where they get what we call osteonecrosis of the jaw, which is similar to osteomyelitis. So it's a challenge.
Okay, except this is not an infected inflammatory process. It's more of an iatrogenic, inflammatory
oxygen
process.
lack.
Yeah.
Yeah, it's more it interrupts the normal healing process. But it's a challenge because if the tooth, now we get into a situation, if this tooth needs to be extracted because it's a source of a problem, but the patient's on bisphosphonates, now it's a risk reward situation. We can't leave this infected tooth in there, but we also have to now be prepared for this osteonecrosis. So it's actually ideal to have a dental exam to see if there's any compromised teeth that we know of ahead of time before they're even put on the prolene. That's ideal.
So how do you address the osteonecrosis? Is this a situation where bone grafts are helpful? Things like hyperbaric oxygenation, oxygen therapy is helpful. Can you talk a little bit about that?
That's not my area of expertise, but that is some of the treatments that they're trying to incorporate if the patient starts to get those symptoms. You know, the best treatment is always prevention. And that's why looking at patients that we know may need these medications because they serve a purpose is to at least get the mouth as clean and healthy as possible before they're started on them. If they're on them, then I actually have a patient right now and her endocrinologist and hematologist are putting her on a drug holiday for 2 months, and we're monitoring her levels. We're trying to get her levels down to a healthier level that we feel comfortable in getting some of her teeth out. She's a newer patient to me, but that's one of the challenges we're facing in treating her right now.
You know, so here I am thinking, you know, I'm doing gynecology because you were a 2-minute dentist, and I don't. So here I go practicing dentistry. You know, I'm taking care of my patients, doing my own overall preventive care. Talk about nutrition, cancer screening. So now I have to add you on the list of my referral.
Yes.
You know, no, but this is interesting because you know, with postmenopausal patient, you know, we know that that day in maybe 7 or 10 years, but the day is going to come when we're going to be looking at bone density and because we routinely do bone density screening, right?
Yes.
So we have to now consider making that referral.
Yeah, we're facing that every day more and more. It's becoming more prevalent because we do have the bone density issue, but now this is a challenge that they're realizing with these medications. You know, when some medications come out, we don't always know what their long-term side effects. We do know now though. So I would say
so maybe with the DEXA scan, you know, we scan the wrists, the spine, and the hips. Maybe we should find a way to image the jawbone and see how menopause influences the bone integrity in the jaw, right?
it wouldn't be a bad idea.
That would be a good study. Very good study.
Be a bad idea.
Yep, excellent
because when postmenopausal women, we do have oral challenges, you know, even pregnant women, because they get what we call pregnancy gingivitis, inflammatory tissues in their gums, and more bleeding. And again, it goes back to that bacterial count going up, and you have that developing fetus. So that's another reason why we want to monitor the pregnant women. But the women that are going through menopause, they have symptoms of very dry mouth. You know, very dry mouth, which makes them more susceptible to decay.
Right. So there you go. Dry mouth, dry eyes. Yeah.
Right. And I put them on. I put the menopausal women as adults. I put them on fluoride supplementation as well to help reduce the susceptibility to decay. So yes.
Excellent. Dr. Court, your hand is up.
Got a question in terms of extraction of upper jaw and as it relates to sinusitis. a sinus infection,
Mm-hmm.
especially the maxillary sinus. Do you see many cases like that?
Yes, I do. So, just from an anatomical standpoint for the people listening, our upper teeth and the molars in the back, the roots of those teeth can approximate the sinus or sometimes actually go into the sinus. So sometimes the patient will have a complaint of sinusitis, but it may be related to a dental infection, and vice versa. Sometimes they can have a sinusitis and they're coming to the dentist saying, "Oh, I'm having so much discomfort with my teeth." So I've had patients come in complaining, "Oh, I have a horrible toothache," and they have perfectly, what we say, virgin teeth with no restorations, no clinical signs from a dental anatomical standpoint, but those roots approximating that sinus. And they're saying, when I change positions, when I sneeze, I have a discharge, and I immediately say, let's have you evaluated for some sinus issues, because the symptoms can mimic each other.
Mm-hmm. Mm-hmm.
So
Excellent.
there is a direct correlation with the maxillary posterior teeth and sinusitis and other sinus challenges.
Mm-hmm. Mm-hmm.
Sometimes patients even say they have an earache. So we have to evaluate, is it the ear, sinus, teeth?
Mm-hmm. Mm-hmm. Okay. I just want to go back to there was that one question about medical plans and appropriate medical plans. I know as far as if you don't have insurance, and I always am a big, rah-rah person about the explore areas that you can get free health care. All right, and the one of the ways that you can one of the things you can think about is the community health clinics. And they're dispersed throughout the country. Actually, in Essex County, the largest one is Newark Community Health Center. I just want to state that they have excellent dental care there. And if you can't afford dental care, you should really look into that. Go into their website, Newark Community Health Center or NCHC, and look into their dental getting your dental care there, because believe me, it's important, and they have excellent dental care at these health centers. All righty.
Yeah, and folks thinks because it's community based, it's less than optimal care, and it's not. Some of these facilities are just welcoming and warm and clean, well kept. The administration is quite efficient, and more as important as the primary care component is the tertiary level care. They're partners with the major institutions, right? So if you need oncologic care, hematologic care, advanced pulmonary care. They partner with the Barnabas Health and the University Health System, and those patients get referred. So it's a well run concept and a well implemented system. Um, but I have another couple of questions to Dr. Rosemont, and it's two, and I'm going to state them and let you talk about them. The role of mouthwash in your daily oral care. Can you talk about that? And then can you talk about prosthesis, implants versus dentures?
Sure. Great question. I just want to add something about the federally qualified health centers.
Mm-hmm.
They're amazing, tremendous source of care for patients. So never let it be economics be the reason why you don't see a healthcare provider. They are tremendous resources in terms of getting healthcare. In my early careers, I worked at a federally qualified health center myself. So I love them. I think there's a tremendous place for them. And hopefully our current administration will leave them alone.
Please.
Yeah, listen, I hope they leave the people like Dr. Court alone and let him do his thing, because there are patients who come through that office, and
Yes.
and sometimes we're the one who providing them lunch, and
Yeah, that's correct.
he never not see them. He always finds a way to get
Still
them
get
at
them in.
least
Get
some
them.
portion of their medication.
Mhm.
And it's really, guys like Dr. Court, Jackson Okoye, those guys, and I call them by names because, I see patients come to me and they don't have, I have a system, to see them in the hospital, and they get charity care. And I said, well, who's your doctor? And it's Dr. Okoye. And I'm saying, how do you see Dr. Court and Okoye and you have no coverage? But guess what? They
We
still
take them.
take them.
We still take them. Yes, we still do.
Mm-hmm.
You know,
Excellent,
We
excellent. Well,
have
that's
a
what
we have a
that's what it's
we
all
have a
about. That's
purpose.
what it's all about. That's why he's always on this show every. every second Saturday because he's just that type of person. All righty.
Good point.
Um,
Okay, let me get back. I
Go
didn't
ahead.
answer
You
the
didn't
question.
finish. Go ahead.
All right, so mouthwash. You know, when I spoke earlier, I said one of the greatest tools I like nowadays are the oral irrigators or water picks because of the mechanical movement and removal of the plaque and bacteria with these devices. I think they're wonderful. They're great. One of the best investments you can make in your oral care. The mouthwashes, over the years, we started out, we all probably grew up with Listerine and the burn and felt the burn was doing something. Well, we've learned over the years that the Listerine had phenol in it, which is a type of alcohol.
Mm-hmm.
Long-term exposure to alcohol for the oral tissues is not ideal. It can predispose you to oral cancer. So we are now, when we recommend mouthwashes, we prefer non-alcoholic mouthwashes. So if you notice when you go to the drugstore, you'll see a lot of mouthwashes that state non-alcoholic. So if you're going to use a mouth rinse, I recommend a non-alcoholic mouth rinse.
Gotcha.
But I really love the oral irrigators in terms of the mechanical removal of debris, followed up by non-alcoholic mouth rinse.
Right.
Now, going back to the other question about prosthesis, there's several ways to restore teeth. The ideal way, when you can, is an implant because it replicates probably the best in terms of a tooth, in terms of it has a root solidly encased in bone, and then your pounds per pressure for an implant is a lot higher than the quote unquote old style traditional dentures. So, treatment number one for missing a tooth, if you have the bone available, if you don't have certain medical conditions that may contraindicate it, is an implant. The next level is what we call a removable prosthesis or removable denture. And the other thing is just nothing at all. So it's just a matter of economics, one. Two, are you physically able to, because of your medical condition and where the bone is located? And what's the third thing? Medical, and then what do you want to solve? What problem do you want to solve? I think it's important to have teeth replaced. God gave it to us for a reason. And if you don't have particularly posterior teeth, you're not chewing and masticating your food as well. And therefore, you're putting more stress on your digestive system. So I have a lot of patients that don't have posterior teeth. And I say, you have digestive problems. And they always look surprised. I said, you can't chew your food. You're not digesting your food as ideally as you can because you're swallowing these chunks of food that should have been masticated a little bit more before it hit that part of your digestive system. It's the first part of your digestive system, your teeth.
All right. So, Dr. Rosemont, it's interesting that we were on this topic because that's the next question. I just want to make sure that we answered it completely. Let me read the question because you answered most of it, but I think if several teeth are pulled, is it mandatory to have implants? I was told that I have to fill spaces because it will cause movement of my teeth. I am 65 years old.
All right. Age has nothing to do with it. I've had patients in their 80s getting implants. You know, the purpose of restoring teeth is to chew and masticate your food properly, which enhances digestion and your overall health. There is a correlation, and I don't have the statistical data exactly, but the amount of teeth that you have missing can affect your longevity. People don't think about that. But if you're not ingesting your food and digesting your food as well, you're taxing your body more than nature has designed, particularly if you have several teeth missing. So it is important to replace your teeth in one way, shape, or fashion because it does have an overall effect on your overall health. And
Excellent.
don't use age. 65 is young. 65 is young. You know, it's don't say I'm 65 as if that's ancient. You really want, and going back to the other part of that question, not replacing teeth leads to movement.
Mm-hmm.
When your teeth start to move, now you create things like food traps, areas where you get more decay, your chewing efficiency is decreased. So it opens up other issues dentally.
Mm-hmm.
So ideally, yes, you should replace your teeth that are missing,
Mm-hmm.
except third molars. Third molars aren't replaced if they're removed.
Say that again, Haniel.
So when people talk about their wisdom teeth getting taken
Mm-hmm.
out, they're
Mm-hmm.
not replaced because
Right.
they're usually taken out because there's a lack of space
Oh,
in the first place.
okay. All right. All right. Dr. Court, your hands up.
Without comment on so-called morning breath.
All right. Morning breath, bad breath is usually related to dry mouth. You know, the person may be a mouth breather, dry mouth, so you get that odor in the morning. It could be medication related, you know. So it is something that needs to be addressed because it's indicating something. You know, is it something that the patient is pre-diabetic, diabetic, or is it just that their oral hygiene needs to be improved, plaque calculus? That's one of the reasons why I recommend to my patients when they use their water flossers or oral irrigators, definitely before bedtime. In a sense, you're power washing your teeth before you go to sleep. So there's no food particles and any areas where you may have food entrapment, you flush all that out before you go to bed. But that's some of the best things I can recommend to reduce that morning breath if it's not a systemic component or a medication factor that's leading to it. So there's several factors that could lead to that quote unquote morning breath.
Mm-hmm.
But dry mouth, we want to get ahead of oral irrigation. And at that point, mentioning to your physician or your dentist to see if it's not a medical component as well.
Mm-hmm. Mm-hmm. Yeah.
Necessary to brush twice.
Minimum, yeah. Brush minimum twice a day. I say if you're home in the middle of the day, you had a meal and it's available, brush your teeth.
Mm-hmm. All right, all right. It's our time to do our halftime follow up and everything. Patrick, I see you have your hand up. Can you wait until after? And
Yes,
then
I think that this question is probably a good segue into the second half. Yes.
Okay.
Say that again.
No, I said that my question would be good in at the beginning of the second half.
Okay,
Yeah,
okay. I'm sorry, I just didn't
yeah.
understand you.
Yeah.
Okay. So our second half announcement. Let's just do this. Let's introduce each other because I'm sure there are people who have come in and after we had introduced ourselves initially. Patrick, can you start, please?
Yes, I'm Patrick Anderson. I'm a gynecologic oncologist. I take care of women with cancer. I'm part of the Barnabas Health Medical Group, and I practice primarily at Newark Bethesda Medical Center.
Okay, sounds good. Sounds good. Dr. Rosemont, please introduce yourself.
My name is Dr. Henry Roseman. I'm a general dentist. I practice in South Orange, New Jersey.
And you have South Orange Dental Clinic.
South Orange Dental Center
Right across from Seton Hall University.
right across the Seton Hall
Strategically located.
All righty. And Dr. Court, please.
Dr. James Court. My practice is internal medicine. I only treat adults. I'm located in East Orange, New Jersey.
All righty. And I'm Dr. Omar Bey. I'm retired pulmonary critical care doctor, and now I'm director of nutritional support for Newark Bethesda Medical Center's intensive care unit. What I'd like to say is that every second Saturday we're here, and we want to answer your medical questions. And it's important to us that our people of African descent, get their medical questions answered. So please, it takes a village. Let everyone know that we exist. We'd love to have 1,000 people show up each second Saturday. That's our goal, to get as many people knowing about us as possible and answer as many questions as possible. Okay, so all you have to do is go to OBHealthy and hit that doctor sign, and of course you just come in and type in your medical question. Thank you. The most important thing I can say is please do not change any aspect of your medical care until you consult your physician. Believe me, only your doctor can truly take care of you from a medical standpoint. Okay, so that's so important. I would like to thank OBHealthy for allowing us to bring this webinar to you. Without them, we could not do this. And yeah, let's keep it going. It was Patrick,
Yeah,
and you
so,
had,
so yeah,
go ahead.
so this is more a comment than a question. So I just want folks to know that when they go to see Dr. Rosemont, they may think he's just focuses on teeth, but from my personal experience with him, I mean, he gets his finger in the corner of the jaw and he's palpating, and he's raising the tongue up and he's palpating and he's looking down your throat and looking. Can you explain to folks when you do that? How is that equivalent to what Dr. Court does when he puts his stethoscope on someone's chest and on their neck? What are you looking for?
So very similar to Dr. Court, I'm palpating nodes and looking for, things such as where we have nodes in areas that aren't ideal. Looking at the conditions of tissues, making sure they're the right color, right texture, we're getting the right movement, range of motion. So it's not just teeth, it's the oral environment. The quality of their saliva. Do they have saliva? Quality of their teeth, the color. So all of these are factors in an oral evaluation. I think sometimes, thank you so much for the question, Dr. Ennis, because it's a point well taken. But a lot of people, they just localize on teeth. It's more than teeth. It's just one of the first aspects of entry into the body. We're part of the whole body organ system, and it shouldn't be viewed separately. Everything is connected. So thank you for that. So we palpate the same way to look for anomalies and abnormalities, and obviously, like anything else, catching things early is very, very important.
Dr. Court, go ahead with your hand up.
Comments in terms of use of manual versus electric toothbrushes.
Okay, I love the new electrical toothbrushes because they're more efficient. I particularly like the spin brushes versus the ones that vibrate because they simulate the movement to remove the plaque more efficiently. A lot of them also have timers on them now. So you can literally just obviously use it, get into all the various areas until it stops. Secondarily, patients that have manual dexterity, as patients get older and they lose some of their manual dexterity, the mechanical devices are excellent. So I like the mechanical devices.
Yeah, and I think too, as the battery technology develops, we've gone from just alkaline batteries, which has short lifespans, to these rechargeables where you can
Right, I like
charge
the
these things
recharge.
for weeks at a time, and you can take them places.
Exactly. Exactly.
What are examples of spin brushes?
Oral-B so without advertising, I think some of the Braun Oral-B, they look very similar to the cleaning devices that our hygienists use. They spin and they just rotate and you just move them along your teeth, using them on both sides, top, inside, outside, and chewing surface. Very, very efficient. And you obviously place toothpaste with them.
All right then. Let's
And
go
now
to.
I'm sorry, Omar. Now
Go ahead.
I think they're combining the spin technology with with the water pick, the
Yeah.
power. Yeah, I think
Yeah,
now they have those combinations.
they do have the combinations because they're realizing how effective and efficient they are in keeping the teeth clean and healthy.
I should ask Haniel also. I mean, not everybody can afford a water pick and a spin rod and all this kind of stuff. What about dental floss? Are we lacking? Are we lacking what we do if we just use dental floss and use it effectively?
No, you're not. I mean, that's the first line besides brushing, flossing. We've just found that patients get an even better response if they have the ability to utilize those devices. But brushing and flossing still will get you a long, long way.
Okay, all right then. There's a question. As a follow-up, it says, is it better to just extract the tooth instead of getting a root canal?
Well, going back to what we discussed earlier, God gave us these teeth for a reason. And that the tooth can be restored properly. Because sometimes teeth can't be restored because the amount of decay has put it in a position where it doesn't make sense to restore it. But if you can't restore it naturally, that's when we may go into either an implant or a removable prosthesis. But remember, we need a certain number of teeth to masticate our food properly. The other thing that happens when you start extracting teeth start shifting, which creates food traps and other issues. So the goal is to try to keep your natural teeth first. If we have to address teeth, we still want to try to keep the initial teeth and healthy teeth that we can restore. If they're unrestorable, that's when we go into extraction.
Excellent, excellent.
All right, so a little bit of personal experience here. The other morning, I got dressed to go to work, and my little grandbaby look at me. She calls me Jeeps. She said, "Jeeps, you know you're handsome," and I haven't heard that in my direction in about 40 years. And and I look in the mirror, and I'm thinking, well, maybe it's my teeth, right? Can you talk a little bit about cosmetic dentistry and how just oral health, how it helps your self-esteem?
Right.
Yeah.
Oral health definitely helps your self-esteem. I have personally seen patients when they've restored just totally brighten up. Their social life improves, their professional life improves. They feel a little bit more confident going into interviews. They feel a little bit more confident going on dates and in social situations. It has a definite effect. Now, I also want to mention that there's this craze right now in cosmetic dentistry, and certain procedures are being overutilized. There's a craze right now for these laminate procedures that I personally feel are being overdone. Some patients, the way to enhance their smile is repositioning of their teeth. Their teeth may be in healthy, but they may just be angled or mispositioned or spaced. In a situation like that, if everything else is healthy, the best treatment modality a lot of times is orthodontic movement to align things properly. Not necessarily doing what we see is going on with laminates and cutting down teeth and putting on these laminates. There's a place for them, but when you have a hammer, everything's a nail. So I say to people, don't always follow what you see on social media. Go to a dental professional and get a professional clinical opinion.
Yeah.
Thank you for that question, Dr. Anderson. I hope I answered it.
Dr. Rosemont, there was a question that came up with, and the patient asked about medical plans. What they were asking was, do you personally take dental plans?
Oh, do I personally take dental plans?
Obviously, they want to come to you.
I do, but I'm not the best person to ask in my office. But we take the plans that allow you to see any dentist. So I would best say to contact my front desk. I'm South Orange Dental Center. .com. We have a website. You can view our website that gives you a lot of information about the services our office provides and our contact information as well.
Okay, all righty. Okay, some of these things I'm not familiar with the words, but I want to try this, and please forgive me if I mispronounce it. I sent this question when I registered, but I would like to hear the doctor's opinion on, and it's called. I'll spell it. Invisil.
Invisalign.
Oh, Invisalign.
I'm just not familiar with it.
Okay.
I currently have. It is an Anglers. It's ALIGNER.
Oh, aligners. I think they're trying to say aligners due to crowding. Yeah.
Right.
Oh, I got you now. I got you. Due to crowding. Okay. What is the minimum hours per day to keep them in?
For aligners, I tell patients 22 to 24 hours. So keep them in most of the time. You take them out, brush your teeth. You definitely sleep with them. But most of the aligners are designed to be worn about 20 to 24 hours a day to get the proper movement that you need.
Mm-hmm.
There's a prescription that goes along with every Invisalign case,
Mm-hmm.
and you should follow the prescription. But
Mm-hmm.
the liner should be worn on average 20 to 24 hours a day.
Okay. All right then. Mm-hmm. Yeah, yeah. I was there's something that I wanted to ask you about. There's so many people now that take blood thinners. And, how do you handle that coming into the office? Because, I mean, if you're a senior, there's a good chance that you may be on a blood thinner. And is aspirin one of the ones that you're concerned about? Tell me how you handle that, Dr. Moore.
Depending on what the patient's coming in for. If they're coming in for traditional cleaning, things like that, basic procedures, it doesn't change and compromise how we treat patients. If they're on a little bit more aggressive blood thinners, then depending on the procedures, we may speak to their physician based on the treatment that they need and discuss whether we may modify their anticoagulant therapy until their treatment is completed. Most of the time, we can manage their bleeding situation without changing their anticoagulant therapies, but it depends on what treatment's needed. If they're just getting cleanings, things like that, usually there's not much modification it needs. If they need multiple extractions, grafting, things like that, that's when we coordinate with their physicians on how we're going to handle their anticoagulant therapy.
Mm-hmm, mm-hmm. That's the blood thinner. Mm-hmm.
Yeah, blood thinner. I'm sorry.
Yeah.
Blood
No,
thinner.
that's okay. That's okay. There's a question that came up. Do is it okay to leave a thin coat of toothpaste on your toothbrush? Oh, have you ever heard of that? Leaving some toothpaste on your toothbrush and not rinsing it off? I've heard that in the past, and
I'm not
that it.
familiar with that. I
Okay.
I would rinse it off because then it's just a source of other issues.
Mm-hmm.
So, but I'm not familiar with that.
All righty. Another question is rinsing after brushing. Do you recommend rinsing your mouth after brushing or not rinsing, right? Like eventually rinsing, but not right away to let the fluoride get in there and do its thing?
All right, so that's two different questions.
Okay.
So if you no, but I'm gonna answer. If you're brushing and rinsing, that's fine. Now, if it's a regular fluoride toothpaste, that's fine if you're using it twice a day regularly. I also give patients a prescription for supplemental fluoride that I have them brush on their teeth and let sit on their teeth for 2 minutes before they spit out, and they don't rinse that out. But that's a specific prescription and a treatment modality for some of my patients that may have dry mouth, as we discussed some of the menopausal women, or some patients that just have a high cavity index.
Mm-hmm.
I may have them on that. So that they hold in their mouth a while before they spit out, but they don't rinse that out. But traditionally, if it's just regular oral hygiene, they can rinse after brushing.
Okay. All right. Another question. I was advised not to brush too often with my aligners because it would compromise the tooth's enamel. I only brush twice a day, but floss after every meal. Is that appropriate?
Brushing and flossing after every meal is always appropriate.
Mm-hmm.
I won't say you can't brush too much. Hygiene is important. If you aggressively brush, you can create a problem. But if you feel debris on your teeth and you have the ability, there's nothing wrong with brushing
Mm-hmm.
if it's done properly.
Mm-hmm.
So I don't think you can overbrush. Remember, enamel's one of the hardest substances known to us. So if you brush properly, I don't think you can overdo. You have to watch your soft tissues, your gums, but your teeth itself should be fine.
Okay, all righty. Is there a certain amount of fluoride that you should use? I know there are fluoride products. Can you over fluoride or under fluoride? What do you recommend? Because since it's such an important aspect of dental health.
Most of the products that are allowed, obviously, that aren't even prescription based, it's a controlled amount of fluoride that you really can't over fluoridate with the over the counter products.
Mm-hmm. 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 there was another. I have a million of them, you know. There was another question that somebody had asked that sometimes when you go to the dentist and they're saying 1, 5, 2, 3, what are you talking about, man?
All right.
He's
sounds like
mapping.
sounds like you playing the lottery on me.
No, he's mapping.
Lottery's big right now. But so around our teeth, we bone holds your teeth. Bone surrounds your root.
Mm-hmm.
Around the bone is your gingival tissue. Gingival tissue or gum tissue. Your gum, we ideally like the depth of the pocket. There's a pocket of gum tissue around your teeth. Ideally, we like it to be between 1 and 3 millimeters. Because at 1 and 3 millimeters, what happens is your toothbrush bristle can clean that pocket.
Mm-hmm.
Once it's over 3 millimeters, the toothbrush bristle can't get there, and that can lead to bacterial inflammation at the base of the pocket, what we call a pocket,
Mm-hmm.
and lead to bone loss. So what we're doing when we're doing that is we're evaluating the pockets around each of your teeth. 3 millimeters or more needs attention.
And what type of attention are you talking about? You
Well,
know, what
we
can
may
you?
encourage them more to utilize some of the oral irrigators to flush out these pockets. Once it goes above 4, then sometimes we also have what we call them recommended for what we call deep cleanings, because we need to instrument down to the base of what those pockets are. And pockets can go down to 10 millimeters.
Hmm.
When they're at that depth, we're at real risk for losing the tooth.
Oh boy. All right. All righty.
Okay.
What else
So
did
if I might ask Dr. Roseman,
Go
you
ahead.
know, again, in today's environment with where public health issues concerned, you know, we have people who are anti-vaxxers, people who advocate vaccinations. We struggle at one point with, you know, getting patients mammograms because they are always concerned about the radiation from the mammogram. Um, can you comment on, you know, X-rays, how you protect patients from X-rays, the risk of X-rays
Sure
during
can.
dental care?
Sure can. So in dentistry, we're quite fortunate too to follow along the medical field. The radiation that comes from our radiation units is very minimal. We protect the patients also. We still use lead aprons to protect our patients, but the amount of radiation now be used in dentistry, what we call digital radiography, where the X-ray, because of our sensors, we need a minimal amount of radiation, even compared to when I first came out of dental school.
Mm-hmm.
The amount of radiation that you get from a full mouth series of X-rays is less than the amount of radiation you would get laying on the beach for an hour. So our X-rays in dentistry are very, very minimal. Our panoramic X-rays, the one that go around the patient's head, is a little bit more, but again, lead protection, computer digital radiography. So I don't know the exact pascals and things like that, but it's a lot less than it was even 10 years ago. So you're very protected with dental radiographs.
Mm-hmm. All right. All righty. Good. Good. There's some more questions. Okay. Okay. This one says, I guess I have to have another discussion with my dentist about implant options that's affordable. I am having issues with chewing and not able to enjoy my food. Thank you for answering my question. So, you know, the thing of it is that, I mean, chewing is so important. I often, from a nutritional standpoint, I find that for a lot of patients, they can't chew their food, especially when they're older and they've lost teeth and or if they haven't taken good care of their teeth, and you find these patients in your office or in the hospital. Um, how do you and what? It, let me put it this way: there are so many fears of going to the dentist, especially in our community. Alrighty, you have this notion that it's going to be so painful and so, you know, what they're going to do to me. How can I, you know, why would I want to subject myself to that? I'd rather just, you know, eat slower, chew less, that type of thing, then go to the dentist. How do we convince people? How do we dissolve that anxiety out there about coming to the dentist and doing, allowing people to do it in a comfortable way and try to just be better at what we do? How do you handle that?
Well, that goes to a little bit of your relationship with your providers. Same way that when the women go to their gynecologist, it has to be a fit. But the reason why you need to go to a healthcare provider
Mm-hmm.
is because prevention is the best way to treat disease. So you want to catch things early, and the way you catch things early is to get regular clinical exams,
Mm-hmm.
to catch things, to be educated on what's available, to know how to better care for yourself. So I know there's anxiety associated with going to the dentist, but try to find a dentist that you can have a good relationship with, express some of your concerns and fears, and that listen to your concerns and fears and make you feel comfortable. Because I'm not saying it's the easiest thing, but it's important.
Mm-hmm.
It's important.
Right.
You
Right.
know.
Stains on the teeth. All right. I know there are certain products out there that you can use to try to, but are there certain stains that you just can't take off and
There
you just
are
got to let be?
there are certain stains that are more difficult to address. We have what we call intrinsic or extrinsic staining.
Mm-hmm.
Intrinsic staining could have been something that occurred when the mother had the fetus and developing. If they took certain medications such as tetracycline,
Tetracycline, yeah. Mm-hmm.
that can lead to some intrinsic staining of the teeth that won't come out with traditional whitening or bleaching things. We don't obviously prescribe these medications anymore to mothers, but every now and then certain medications and things that people take that are over the counter, or that's why it's very important to discuss with your OBs and things like that what supplements you're taking, because you don't know some of the effects that these medications or supplements may have. So there are stains that can't be removed with traditional whitening because they're intrinsic, meaning they're in the enamel, they're in the dentin. And then we do have some extrinsic staining, such as if you drink a lot of red drinks and blue drinks and things like that, they have a higher susceptibility to be able to be removed. Or coffee, things like that.
Don't say coffee,
Yeah,
please.
leave coffee out of it.
Listen, I drink coffee too.
Coffee and red wine.
Coffee and red wine. You named two of the biggie. But you see, you guys go regularly, or you see you guys regularly, and that can be addressed and cleaned up.
Yeah.
How about
Yeah.
whitening?
So people are sometimes, again, this social media craze are overdoing it with the whitening, right? Some of these products now, they are peroxide based, which can, if overused, be detrimental to the enamel. Again, if you have a concern, see your health professional to see if it's an extrinsic situation, meaning if it's externally produced, or was it developmental because your mother took tetracycline. Have it professionally evaluated rather than just throwing some of these products at it.
Okay. Just simple signs that tell you that you have unhealthy mouth and unhealthy teeth. I mean, you know what I mean? Not to get fancy, but if I'm brushing my teeth and every morning I'm spitting blood, should I be worried?
Yeah, okay, that I understand. Bleeding gums is the first sign of gum disease or periodontal disease. We call it gingivitis, but it can also be indicative of progressing on to periodontal disease. So bleeding gums is not normal. That's a sign of an inflammatory process. You may need just a good cleaning to get everything straightened out, but it's not something to be ignored.
Right.
So it's the first indicator to maybe have somebody assess you and get a good cleaning. Or you may have traumatized yourself, but more than likely, if you see it every day, it's related to an inflammatory process going on with your gums.
Okay. I'm just gonna go through a few things and tell me if it's real or Memorex. Alrighty.
I'll do my
When you
best.
have areas of swollen gums, even if it's not painful.
Swollen gums needs to be addressed to see what the source of it is,
Hmm.
whether it's hormonal, whether it's hygiene related, whether it's medicinally related. It shouldn't be ignored.
Hmm. And usually, if there's cancer involved with gums or anything like that, is it usually painful or can it be non-painful?
It can be not painful as well. It could be you may not have any symptoms at all. So that's another reason why you want to get regular evaluation.
Okay. Persistent bad breath.
Persistent bad breath, again, find out the source.
Hmm.
Is it hormonal diabetic? Is it lack of proper oral hygiene? Is it dry mouth? So they should be addressed. It shouldn't be something that's ignored.
Right, right. If you have sensitivity to hot and cold or sweets, very sensitive. Anything come near, ooh, ooh.
Needs to be evaluated.
Mm-hmm, mm-hmm. Right, right. And
To rule out
oh,
what?
Excuse me?
To rule out what?
To rule out that there's not any decay progressing towards the nerve. I mean, sometimes people have what we call root sensitivity, meaning they don't have any decay, but when they have something cold, say like even ice cream, you get that
mhm,
that shock.
right.
Sometimes it's just that. It's just an extreme temperature change, but you want to evaluate that it's not decay going, progressing to the nerve. So it's just a matter of getting evaluated. It, it
Hmm.
may it may not be anything to be concerned about, but you should get it evaluated. If it's
Right.
consistent, hot, cold, sweet, it may be indicative of leakage of some or decay progressing in the area.
Okay. What about chipped teeth? Do you find that, I mean, a lot of times you can have a little bit of a chipped tooth and then you say, oh, it's no big deal. You know what I mean? It doesn't hurt me. Should I? Yeah, I'm not going to go to the dentist. Can we get away with a little piece of chipped tooth and not take care of it?
You can if it's in the enamel. Remember, I told you three layers of the teeth:
Oh.
enamel, dentin, and
Mm-hmm.
nerve. If it's still in the enamel, there's still amount of protection. And if it's not a cosmetic issue or it's not cutting your tongue or anything else, you can get away with it depending on where and the depth of the, the fracture or the chip is.
Okay. All right then. Um, when do you primary? I understand that you said that if you got some time, brush your teeth. But when do most people brush their teeth? Is it before breakfast or after breakfast? And what do you recommend?
I recommend before breakfast.
Mm-hmm.
In the
Mm-hmm.
morning, first thing in the morning, and definitely before bed, last thing before going to bed.
Mm-hmm.
The other times it can be situationally based, but I recommend if you have a chance to brush after eating in the middle of the day, or even if you're free in the morning, you can brush again after breakfast if you choose. But I always tell people first thing in the morning to brush your teeth.
Right, 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 right. All right then. Um, I'm gonna just bounce back. There's a patient that has if a patient has something like sickle cell, which is common in our fairly
Mhm.
common in our community, believe it or not.
Mhm.
And what I find that there was this one patient that had sickle cell, but it involved the teeth area, and did not take good care of their teeth. But because of the sickle cell, it seemed like there may not have been an appropriate blood supply or whatever. Do you find diseases like this coming into your office where um, there isn't a good number one solution. Like you got to figure out like how are we going to really handle this one because this may not be in the medical books or this may not be. I'm going to have to put this together. And how do you handle those special cases? That do you just step back, or are there consultants that you use, or are there people that is there a group of docs that you can talk to that may have more experience in one area or the other? And also after that, I want to talk about oral surgery, where we go with that. But first, let me get to this aspect of it.
Well, I think when we have a lot of dialogue with patients, various healthcare providers, the specialists, the hematologists, it's a team. Everything is a team.
Hmm. Hmm.
Just I think a lot of times they forget about the dentist. You guys in the hospital all communicate, but they forget about the dentist. I work with all my patients' healthcare providers when we have a situation I'll reach out and say what's going on, what we'd like to do, or their providers may reach out to me and say they have some concerns. What are my findings and what are my treatment options?
Mm-hmm.
A lot of times I find when patients are compromised, from a dental standpoint, sometimes we just give what we call palliative care, keeping them clean and healthy, removing any disease sources.
Mm-hmm.
For us, a lot of times that benefits our medical counterparts because it reduces the source of infections and inflammation that may be affecting the areas that they're treating. You know, our cardiologists, nephrologists, and various specialists, and particularly that the bacteria coming from the mouth may be contributing to the organ systems that they're addressing. So a lot of times for us, it's really just quote unquote cleaning up the patient's mouth.
Mm-hmm. Mm-hmm. I got you. I got you. Oral surgery. Is that part of what you do, or is there a special oral surgeon that does
Their
this?
specialties, we have multiple specialties in dentistry. We have oral surgery, we have endodontics, we have let me break it down. So oral surgery, that they do a lot of surgical procedures, treat oral cancers, fractures of the mandible, things like that, trauma cases. That we have endodontists that specialize in doing root canals. We have pediatric dentists that obviously specialize in treating children. We have prosthodontists who specially is restoring particularly large cases that need multiple teeth to be replaced. What other specialists am I forgetting? We have oral pathologists who treat and diagnose pathological conditions. Periodontists who treat the gums and bones.
Mm-hmm.
I know I'm forgetting somebody. I'm forgetting somebody.
You're right. We all forget somebody, but you named quite a few there, though.
Yes, but we do have specialties, subspecialties that focus on those particular aspects of dental. The oral surgeons tend to do the trauma, the infections,
Mm-hmm.
head and neck infections, and
Mm-hmm.
wisdom teeth, things like that.
All right. Does it sometimes involve ear, nose, and throat as well? You know, it gets to that degree, like
Cleft
you an
palate.
ENT person.
Cleft palate. A lot of times there's a lot of cross communication with the ENT with the cleft palate patients. Yeah,
Mm-hmm.
so there are times, and sometimes sinus. You know, as Dr. Court mentioned earlier, when patients have maxillary sinus challenges, is it sinus or is it dental?
Right.
So
Now,
yes,
I know that I come to your office and you got all these fancy machines, man. Tell me about some of the new stuff that you know that's come through your office the last 2 years or several years that you can do now that you couldn't do in the past.
well, you know, AI is getting in everything. So now
Mm-hmm.
we have the ability, we have scanners now, so we can scan the patient's mouth intraorally without radiation
Right.
and move it around and educate patients visually on
Mm-hmm.
some of the challenges they have going on in their mouth. So, you know, in the old days, you see the dentist with this pick and think, what are they digging at and what are they pull? So now, because we're able to scan it, we can actually blow it up on a screen and point to things that are going on in the patient's mouth, areas that they're missing, areas of concern, areas where there's decay. So we have scanners that do that. Our x-rays now, as we stated earlier, are digital. So we can manipulate the x-rays again to see certain things that we couldn't see before. And one of the things that just came into dentistry, but is very interesting with our AI is that AI has now integrated with our dental. Well, the doctors have to acquire it, but it can integrate with our dental x-rays and look at past x-rays, I think going back 7 years, and actually can detect changes that we can't actually see with our eyes and give us a report to look for certain things. So that's pretty exciting.
Mm-hmm.
So that's some of the things. We also have, I think you're referring to CAD/CAM dentistry, where we can now scan patients for certain things and actually in office make restorations or crowns in the same day to place on patients' teeth.
So wait a minute, you can make a crown. So you got a machine there that's just gonna put some plastic together and say, here's your crown, right where.
Well, it's not that simple, but we can scan. We have digital scanners.
Right,
We create models on the computer and
right.
design a restoration or a crown on the computer. That data is then sent to what we call a milling unit, and that then prepares and creates that crown that day. Yes.
Mm-hmm. Yeah, yeah. So it's like, what is that called? I'm blocking on it.
It's not, you're thinking of a printer, like
Yeah,
Like 3D printing.
3D print.
It,
Yeah,
it's similar, but think of it from a standpoint of you have a hard block first, say a rectangular block, and
right.
it will cut that restoration out of that block.
Oh, got you. I got you.
Versus building a 3D printer sort of builds it.
Builds it from right,
Right. This one kind of shapes
right,
it,
right.
almost
Shaves it and then
sculpts
makes
it
it.
down from a rectangular or square block. Yes.
Interesting, interesting.
It's
All
very
right,
exciting.
boy, oh boy. I'm telling you, you're. I mean, dentistry has changed so much over the last, say
It
10,
really
20
has.
years. It's
It
just
really has.
dramatic
Most of the
what you're
things I'm
able to do.
talking to you about, they weren't around when I was in school. This has
Mm-hmm.
progressed, over the years. As technology has moved forward, it's been incorporated into our industry, and it's quite exciting. That's why I'm saying if people haven't been to their dentist in a while, go visit. It's not the old dentistry that you're thinking of where it's necessarily uncomfortable. We have a lot of diagnostic tools now that can catch things early, get
Mm-hmm.
you healthier, get you chewing and eating better. It's needed. It's not something that's just for emergent. It should be just
Right.
part of your regular um, healthcare maintenance, just like you see your cardiologist, your nephrologist, and your general family practitioner. You should see your dentist.
Mm-hmm. Mm-hmm. The thing of it is that, there are a lot of doctors out there, good doctors and bad doctors, good lawyers, bad lawyers, good, you know what I mean.
Yes, I do.
Um, how do choose a good dentist, especially with all the anxiety of going to a dentist? Then
You
you're trying
know,
to choose one that you feel may not hurt you. Because I must step back and say that I've been, you're my dentist, and I'm very pleased because I'm one of those people that I'm not down for the pain,
nobody likes pain.
and you have a technique. Even when given an injection, I don't feel it. You know what I mean? So it's just one of those things that there are some people that are good at their job and some people that, the job gets done, but it was done in a different manner. That's all I'm going to say. How do you find out prior to sitting into that chair who's
I
the
don't know
good
if you can
guy
find out
and who's
prior.
the bad guy?
I don't know if you can find out prior. I think I've really been very conscious of making the experience as comfortable as possible because I know that's one of the number one reasons why patients aren't going. Fear
Yeah.
of discomfort,
Yeah.
So it's very relationship oriented. You
Hmm.
have to be, that's one of the reasons why we're even doing this forum.
Right.
We
Right.
we, we have to have our patients comfortable enough with their
Hmm.
providers that they could share their concerns. And I think as providers, we are, not should be, because we're here, be compassionate enough to understand our patients' concerns and needs and address them. They're
Hmm.
coming to us for care and advice. And I think it's really important, particularly doctors of African descent, treating patients of African descent. And we know some of the things that have happened in the past that have created anxiety towards healthcare providers. So I think it's important that we're conscious of that and never forget that.
Right.
So I can't say I've had a bad day and did a procedure and a patient said, that was uncomfortable today, doc. But I think one of the things you have to remember about dentistry, like in any healthcare, when you're anesthetized properly, it should not be uncomfortable.
Right. Right.
Right. So with anything, if something's uncomfortable, you're not anesthetized properly.
Right.
And we always tell our patients, if you have any discomfort, let us know so we can get you comfortable.
Right.
So it starts with that. The procedure should be comfortable. Any procedure that a healthcare provider does, patients, if they need anesthesia, should have adequate anesthesia. And
Right.
that's where it starts. And that's just really listening to your patient. I can't, that's why I asked you, are you numb? Are you comfortable? I can't answer that question for you.
Right. Right.
So in choosing your healthcare provider, that's the number one thing, just communication between the doctor and the patient.
Right. Right. Right.
And the compassion of the doctor to listen.
Right. There you go. There you go. You know, the thing of it is that I think to a certain degree, if you have anxiety, you should interview that doctor just like you interview anybody else.
Yeah,
You
I
know,
agree.
you
I
should
agree.
use you, and also use the web. Check the reviews. You know, check Google and figure out if anybody said what people are saying about him. I mean, just take, you know, as some of the kids said, let's ask Google. You know, Google will tell you whether this is a bad guy or, you know,
Right.
not bad guy, but whether his technique is appropriate for you or not. You know, that
I will
type of
say
thing.
this. I will say this. You know, we as people, I've known of Dr. Court for several years. We have a lot of common patients. He doesn't even realize this. My
Really.
patients love Dr. Court,
Yeah.
love Dr. Bay, love Dr. Anderson. All of you guys, I see your patients, and they tell me how much they love you guys. You know, whether they always, you know, it's funny, our patients don't always tell us directly, but they tell their family and friends. You know,
Right.
why? I know that everybody on this call and on this is a caring healthcare provider.
Yeah.
Everybody on it. And our patients sense that. They know that we listen to them, we hear their concerns, and we want to get them healthy. And I think that, you know, that's one thing I could say when the patient's looking at their provider, does this person care about me? Does this person want the best for me?
Mm-hmm.
That's all. You know, I'm just coming from the heart right now. You know, it's not always you know, I'm pre-Google, but now we're Google. But you know, go by how you feel. How does this person make you feel? Did
Right.
they help you?
Right.
Do they care about me? Do they want the best for me? And I know everybody here does, and we
Yeah.
know a lot of clinicians that do.
Yeah. I think, you know, we live in a era where immediate gratification is the order of the day, you know, and folks want to know that they come in for a 10 o'clock appointment and they're out in 15 minutes. But the work that you do, you cannot accomplish adequacy in 15 minutes, right?
Correct.
And I often say, if you come in and I did an exam and you're in and out in 15 minutes and you leave wondering if you ask all your questions, then I really did not address, you know, the full scope of why you're there, you know. You know, when we get to do an initial intake and we get a family history, the family history doesn't end there, right? Because your family history just doesn't stop, right? So I want to know how your grandson is doing in basketball,
Right.
right? Because when I initially spoke to you, he was just thinking about it. Well, in the last 6 months, did he play ball? You know, how did he like his position? Was, you know, did that help him academically? You know, when patients leave and feel like the conversation is all encompassing, you know, then
Right.
you really have delivered, right?
Exactly.
Yeah.
Exactly.
Right. Right. Excellent.
We
And
take care of our patients.
That's
well,
it.
that
We take care of our patients. That's all.
That truly is it. You know, you are concerned. You like to see, oh, did your son or daughter is going to college? You know,
Mhm.
you know and it is, you know, for the patients watching, it is rewarding for the clinicians too to hear these wonderful stories too. We really enjoy it too to watch people get healthy and people to move on. That's some of the most rewarding.
That's our purpose.
So part of you know, Dr. Roseman, one of the reasons when we started this, we were going into church halls and in church basements until COVID came, and
Right.
Omar said, "I have an idea. Why don't we just go on the web?" And we've been doing that since. But one of the reasons we want to know these questions, we ourselves are looking for mentoring opportunities, right?
Right.
So by asking, you know, I said, "Oh, well, is he interested in math or science?" Because we know someone who's a good math tutor. We know
Exactly.
someone who say, listen, I can ask Dr. Court if you could just shadow him in his office just to see if you're this is something you're interested in. And
Yeah,
you know,
Yes, that's very important.
Yeah.
Very
yeah.
important. Let
We do.
reach out. We had our holiday get together for New Jersey Medical Association, which is the Black Medical Association for New Jersey, and it's the New Jersey chapter of NMA, National Medical Association. And
hmm
the one thing that was highlighted that night is that there's so many senior physicians that are willing to, you know, help the young ones come up, help guide, help talk. We're here. Reach out to us. That was so apparent that night that we're just trying to reach out there to our young people and let them know that we care, that they, that they're interested, that they're doing what they need to do to go to school and learn. But if you need that guidance, if you need that inspiration, if you need that someone to just give you that encouragement, or even put you in the right position, try to help put you in the right position so that you'll achieve what you need to achieve or want to achieve, we're here for you as an organization, and that's New Jersey Medical Association. Dr. Damalia Campbell is our president, and she's doing a wonderful job with that. So if you have any question, any young people out there that have any question, go to New Jersey Medical Association's website and reach out to the docs. Just one thing that just came to my mind, and because of what you said, Patrick, boy, I'm telling you, it's just exciting to know that we can help young people. Alrighty. Dr. Rosemont, this is what I'd like to do. In summing up, I'd like you to just sum up and, they just chop, chop, chop. What do we need to do to have that beautiful smile, man? Tell me about it.
I think it starts with where we start. So patient education is extremely important. And how do patients get educated? Visit the dentist. Regular visits. Prevention is the best treatment. If anything, just see your dentist to get a regular evaluation and checkup. It
Hmm.
will make a tremendous difference in your life. Catch things early. Get comfortable with your provider. Ask questions when you go in and educate yourself. And then when you become educated, educate your family members and your community members. Because there's a lot of things that have come in dentistry in the last 20 years. Some of the things that people are holding on to is ancient news. So go in and experience what's available. We know so much more about how to stay healthy in all
Hmm.
aspects of your life,
Hmm.
including dentistry. So
Excellent.
that would be my biggest push.
Hmm.
Visit regularly. Don't wait for a situation where something's bothering you. Go in and get a
hmm
clinical evaluation and check.
hmm
Okay. This is what I want to say. And there's one more question that uh,
Coming in.
Uh, there are two more questions. One just popped up. Okay, but we're going to answer those. But the one thing I would like to say, and this is for mostly for our seniors, because a lot of time our seniors are going to a doc and they just don't want to change that doc. You know, so all I'm saying is that if you're going to a new dentist or anything like that, don't be afraid of a second opinion. I'm a believer, 110 believer. If you feel that your dentist has said something or what, and you're questioning it, you know what I mean? Or if you're primary care or if you're GYN or whatever, if you have a question and they didn't answer your question appropriately, a second opinion is valuable because I just feel that, you know what I mean, that physician may have been 100% right and on point, but if you have a question, then get a second opinion. And because I'm just dogmatic about that. These questions that we have here. Number one, let's take this one. What are your thoughts, recommendations, and ideas on ordering teeth by
By
mail
mail.
order? Check this out.
Right.
All
Yeah.
right. I've seen ads where you can take impressions of your teeth and send them back to a company where they will make the teeth, then send them back to you. Um, what's your impression on that?
All right. So my impression on that is, we've gone to school to learn various aspects of how we treat people. When you're taking an impression and sending, who's really evaluating what you're looking at, and how can it be adjusted, modified, or monitored if there's nobody to make sure it fits properly, it's doing what it's supposed to do, and if it's not causing damage. So you need to see a trained health professional, in my opinion.
All righty. Okay. This other one is I'm going to spell it again because I'm going to mess this. I'm going to mess this up.
This
The
is
one, the alignment.
or traditional. Invisalign or traditional braces.
Yeah. Invisalign. I'll try it. Or
All right.
traditional brace or traditional braces.
All right.
What's your opinion?
Which one? There, you know, in healthcare, there's clinical indications for different treatment modalities. So there's no absolute one way or another. Certain situations, there are limitations to Invisalign, and there's challenges with braces when patients may not want the appliances to show for whatever reason. I like both treatment modalities, and it just depends on what we're trying to accomplish and what some of the patient's concerns and desires are, and some of the clinical indications. But both of them are great treatment modality, just individualized by the patient's particular situation.
Right. Excellent. Dr. Rosemont, I'm going to have to just thank you for coming on, brother, because this was an excellent webinar. I think this topic is so important, but sometimes it's forgotten. And I think we need to keep bringing it up. Next year, I'm going to probably call you again, and we're going to do it again because we just need to keep pounding pounding the door. Squeaky door gets the oil. Squeaky wheel gets the oil. You know how it is, so we just have to keep it out there. Thank you very much for taking the time out of your busy practice to come in and enlighten us and everyone out there. And we're just going to keep doing it. All right.
Thank you for having me. And I'd also like to thank you, gentlemen, for what you do, because you inspire me as well with how I know you treat your patients in the community. So continue, a job well done. And I'm just happy and privileged to have an opportunity today to contribute, because this is very important work that everybody here is doing.
All right. Thank you very much. Thank you. So in closing, our closing remarks, I would like to thank OBHealthy for allowing us to bring this to you. It's just so important, and I just try to stay on their good side because I don't want them to rip off and run away, and we're not able to bring it to you. So I thank them immensely. Understand this is every second Saturday. We're here, right here, to answer your medical questions. And please note that we have prior webinars. Just go to obhealthy.com and click on the doctors. You can see a camera right there. Click that camera. All of our past webinars will come up, or hit our YouTube logo and the past webinars will come up. Please subscribe to the YouTube channel so we can continue to bring that to you. Remember, it's caring and sharing. Please let everybody know out there, hey, it takes a village to really do something positive in our community. So that's where we are. Don't change, and this is the most important thing. I will say this: do not change any aspect of your medical care until you consult your physician. Only your doctor truly can take care of you from a medical standpoint. All right. I look forward to seeing everybody next month. Please join next month. And all I'm going to say is health is everything, and spread the word. This is OBHealthy's Doctor's Lounge. Until next month, brothers, I will see y'all. Dr. Rosemont, thank you. Dr. Court, Dr. Anderson, all good. All right, see everybody next month.
All right.
Yeah,
all right, peace now. Peace.
All right.